Good evening. My name is Angeline Ogle, and I am a master's candidate with UTA. Tonight, I'm going to be presenting a mock interview with a client. Jennifer Nelson is a 42-year-old female referring from a physician. She is presenting with symptoms of depression and anxiety. For assessment purposes, I would give the Beck depression and the Beck anxiety inventories to assess the level of severity of symptoms. I've chosen cognitive behavioral therapy as treatment options for this patient. And this will include journaling, exercises, deep breathing, muscle relaxation. In addition, working with the referring physician for prescription of medication such as an SSRI. This will assist the patient to deal with the symptoms and kind of get over that hump so that they can get started. So the first step in working with a client's depression would be to have an initial meeting and introduction to assess the client and determine next steps. We will be using cognitive behavioral therapy with this patient. So good morning. My name is Angeline Ogle, and I'm a social worker. Your name is Jennifer Nelson, correct? May I call you Jennifer?
Yes.
All right. Well, your family physician has referred you to our agency for depression and anxiety. Can you tell me what symptoms you've been experiencing?
I've been feeling really low the last few weeks, maybe about 2 months. I just don't have the energy to do things that I used to enjoy. Just getting out of bed is a chore. I feel like I'm going to burst into tears at any given moment. I just can't shake this feeling. I feel stressed out and anxious all the time.
Oh, okay. Well, so what I'm hearing you say is that you are having some issues and showing some symptoms of depression and anxiety. Have you ever felt this way before?
Occasionally in the past, my boyfriend broke up with me 2 months ago. I thought I was okay with it, but since the COVID hit, I've been working from home all the time and not going out. I feel so alone and isolated.
So after continuing to assess the client's feeling and feedback, doing the Beck inventories and having her gauge for the symptoms and the severity, I would then make some introductory suggestions for the first set of homework. So Jennifer, first I would like to suggest to you that you keep a journal. Have you ever kept a journal before?
Yes.
All right. Well, especially when you find yourself feeling really anxious or depressed, or if you feel like something's going on inside, you feel that teary feeling, you start feeling that panic feeling, that would be a great way to start. And also, I would like to give you an action step for homework. Do you like going for walks?
Yes, but I haven't had the energy to even get off the couch here lately.
Okay, well, so your first homework for this week, other than journaling, is to find some time to take a short walk outside each night. It doesn't have to be too far or too long. Just get moving and let me know how you do over the next week. So at this point, I would have the client take part in a visualization exercise just to prepare herself for what would be going on. So Jennifer, one of the steps that we identified as a means to decrease your stress and anxiety is to take a daily walk. Do you think this is something you might be willing to try?
I know I need to be more active. It's just hard getting off the couch.
Well, making changes definitely takes time. So let's practice with an experiment. I want you to close your eyes, and I want you to visualize getting up and getting outside. Does that make sense?
Yes, how?
All right. So close your eyes and try to visualize your neighborhood. Can you picture it?
Yes, I can see it.
All right. Well, when you see that picture in your head, do you see in color or in black and white?
It's in color. Lots of flowers are blooming in the neighbors' yards.
Oh, that's wonderful. So now imagine yourself walking down the street, waving to your neighbors as you pass.
Okay, I really like some of the older folks down the street.
Okay, so how does it feel to be out in the sunshine, saying hello, smelling those beautiful flowers as you pass?
It feels really good to be outside. I miss seeing and talking to the people.
Okay, well, now let's change gears a little bit. In that mental picture, that visualization, I want you to tell me what would happen if it rained. Can you tell me how you would still exercise without being outside? What does that picture look like in your head?
I can walk on my treadmill. It's just in the extra closet right now.
Great. Okay, so let's make a plan to get out and do what you visualize, and you can tell me about it the next time we meet. And don't forget, journal in your journal every day and let me know about those feelings, okay? All right, so the next step of treatment would be the follow-up meeting to see how the first week went. And at that time, we would talk about the journaling and we would do some deep breathing exercises. So, good morning, Jennifer. How did the journaling go?
I did write in my journal. I got upset a few times thinking about my ex-boyfriend. I got sad. I also get anxious when I think about getting around new people.
Okay, so that's actually a good first step. Instead of focusing on the problems, I want you to focus on how we can turn these around and to be a positive solution. So now that we know some of the things that have been triggering you, when you start to feel sad about losing your boyfriend, think of this time as a time when you can work on what a good relationship means to you. You can write down things like what you want out of a relationship, what you want out of a man, what you want to find in that true partnership type of relationship. You can also think about that you do get anxious when you think about being around new people. Well, start out about thinking about how you felt when you met some people that you now consider to be good friends. How long did it take for you to get to know them? Did it feel good? Was it scary then? Or is it just a new feeling since COVID? So think back in your next set of journaling. I'd like for you to kind of think on that and think about how you can turn those around into a positive experience. All right, so one of the other steps that we identified as a means to decrease your stress and anxiety was to go on a daily walk. Were you able to do that?
Yes, and it felt really good. I didn't get out as much as I planned because of the weather, but I used my treadmill one of those days.
Great. Okay. So let's work on another way now to deal with your anxiety. You've got the exercise going. You're writing in your journal to kind of look for those triggers. So today we're going to do some deep breathing exercises and some deep muscle relaxation. Are you ready?
Yes.
Okay. So what I want you to do is I want you to get comfortable. Put both feet down on the floor and lay your hands in your lap. Are you comfortable?
Yes.
All right. At this time, I want you to close your eyes, and I want you to take a deep breath in through your nose. Hold it while I count to 3. 1, 2, 3. Now exhale slowly through your mouth. Very good. Let's do that one more time. Take a deep breath in. Hold it. 1, 2, 3. Now exhale slowly through your mouth. In your mind's eye, I want you to visualize being in a warm place. A place where you feel safe and secure. And I want you to take another breath. Breathe in. Deep breath. Hold it. 1, 2, 3. Now exhale slowly. Think about that warm place. Is it an island? Is it your home? Find a place that makes you feel secure. Some place that makes you feel happy and light. Now, I want you to flex your toes. Take a deep breath. Hold it. 1, 2, 3, and release. Relax. Now, I want you to take a deep breath in, flexing your calves, breathing in through your nose, and hold it. 1, 2, 3. Release. We're going to move up to your thighs. Count with me. 1, 2, 3. Relax. Let's Squeeze in your tummy muscles. Hold it tight. Deep breath in. Hold it. Release and exhale. And then you can open your eyes. Does that feel a little more relaxed?
Yes.
All right, is that something that you feel like you could do when you start feeling anxious or stressed?
Most definitely.
All right, well, this is called a centering technique. This is something that you can help cope with your anxiety, cope with those feelings, and anytime you feel one of those triggers coming on, or when you start to feel anxious, you can stop what you're doing and you can do the deep breathing. Just a few breaths even, in and out. Squeezing those muscles, relaxing them will help. Another visualization technique that we have is the 5, 4, 3, 2, 1 method. Would you like to try that?
Yes.
All right, I want you to again get comfortable. Close your eyes. And in your mind's eye, I want you to think of 5 things that you can touch. Think of 5 things around you. 5 things that you can feel with your hands. Actually feel them in your mind. Now think of 4 things that you can see. What are 4 things that you can see around you? What color are they? What do they look like? Then move on, 3 things that you can hear. Is the clock ticking? The wind blowing? Birds in the background? Focus on those things that you can hear. Then I want you to think about 2 things that you can smell. Is there food cooking in the kitchen? Can you smell your perfume? Maybe it's a stinky smell. But 2 things that you can smell. And then lastly, we've done touch, we've done sight, we've done smell, and hearing, and now let's do taste. What is something that you can taste? After you've done those 5 things, you can open your eyes, and usually after going through all of those 5, 4, 3, 2, 1, you'll feel more centered, you'll feel calmer. This is a good thing to do when you're angry or when you're stressed. And this can help you and you can do this in any combination. It might be 5 things that you can see. It might be 5 things you can smell if you've got a lot of sense going on around you. Whatever order that you want to feel your senses, go through that and that will help you. So as we would continue to meet with this client, we would continue to look at her journaling. We would continue to look at the different things that she has done. We would praise her for her successes. We would look at the setbacks and see what those triggers are, and we would address the triggers as they come along. The key to cognitive behavioral therapy is recognizing what sets us off, not looking at the past, not looking at what caused the trauma or the depression, but moreover looking at what is triggering, what is causing the trouble now, and how we can address that and make changes in our lives. So Dr. Cobb, I hope you've enjoyed this video. I know it's a little shorter than it could have been, but I've truly enjoyed your class and truly enjoyed learning all of the ways to be a better practitioner, and I look forward to serving as a social worker in the future. Thank you. Have a wonderful night.